Every morning, millions of men wake up and face a silent struggle that no one talks about. A body that used to respond effortlessly now feels disconnected, distant. There's a wall between intention and action. You've probably tried exercises, changed your diet, maybe even bought supplements that promised the world but delivered nothing. And the worst part? The confusion, the frustration of not knowing what's actually broken inside you. But what if I told you that the solution isn't about taking more pills or doing harder workouts? What if the answer has been sitting right beneath the surface of your skin this entire time, waiting to be activated? I'm Dr. Sarah Vance, and I've spent over 15 years in clinical urology, treating men who thought they were out of options. My office isn't like the sterile, impersonal clinics you're used to. When you walk in, I don't hand you a prescription and send you on your way. I sit down with you, I listen, and then I teach you something that most doctors either don't know or won't take the time to explain. A 3-minute ritual that targets the very root of erectile dysfunction at the vascular level. This isn't theory. This isn't pseudoscience pulled from a blog. This is a hands-on technique I've used with hundreds of patients, and the results have been so consistent that I now consider it the foundation of my treatment protocol. The technique is called the Perineal Tissue Mobilization, or PTM for short. It sounds clinical because it is. This is a medical intervention disguised as a morning routine. The perineum, that often ignored area between the base of your testicles and your anus, is home to one of the most critical muscles in male sexual function, the bulbospongiosus. This muscle acts like a hydraulic pump. When it contracts properly, it forces blood into the erectile tissue and traps it there, creating firmness and stability. But here's the problem. After years of sitting at desks, chronic stress, poor circulation, and hormonal decline, this muscle becomes dormant. The nerve pathways that control it go quiet. The tissue itself becomes stiff and unresponsive. And when that happens, no amount of arousal can compensate. Your brain is sending signals, but your body isn't listening. I begin the PTM with what I call the awakening phase. You lie on your back with your knees bent and feet flat on the floor. Using your index and middle fingers, you locate the bulbospongiosus muscle by pressing firmly into the perineum, about an inch behind the base of the scrotum. You'll feel a ridge of tissue beneath the skin. That's your target. For the first 60 seconds, you apply rhythmic pressure directly into this muscle. Not a light massage. Real pressure, deep enough that you feel the tissue resist and then slowly yield. The goal here is to trigger involuntary contractions. You're waking up nerves that may have been silent for years. Some men feel a tingling sensation. Others feel a dull ache. Both are normal. What you're doing is forcing the nervous system to recognize that this area still exists, that it still has function. After the first minute, you move into the glide phase. This is where the magic happens. You shift your fingers slightly lower, to the base of the perineal body, and you begin a slow, deliberate upward stroke toward the pubic bone. Imagine you're pushing stagnant fluid out of a narrow tube. You're applying firm pressure in a milking motion, forcing oxygenated blood through the arteries that feed the erectile tissue. This isn't about pleasure. This is about circulation. About forcing the body to remember what it feels like to flood those tissues with fresh, oxygen-rich blood. You do this for 60 seconds, maintaining consistent pressure and rhythm. I emphasize that consistency matters more than intensity. If you rush it, you'll miss the point. The tissue needs time to respond. The final phase is the lock. This is where you combine the physical work with controlled breathing and pelvic floor stabilization. You place one hand flat on your lower abdomen, just above the pubic bone, and the other hand remains on the perineum. You take a deep breath in through your nose, hold it for 5 seconds, and as you exhale slowly through your mouth, you contract your pelvic floor muscles as if you're stopping the flow of urine. At the same time, you press down gently with the hand on your abdomen. This creates a compression effect that traps blood in the erectile chambers and prevents venous leakage. You repeat this breathing cycle for 60 seconds. By the end of this third minute, Many men report a noticeable warmth in the pelvic region. Some even experience spontaneous firmness. That's the body responding. That's the tissue waking up. I've seen this technique change lives. I've had patients in their 50s and 60s who hadn't experienced morning firmness in over a decade suddenly wake up with it again after just 2 weeks of daily PTM. I've had men who were on the verge of accepting pharmaceutical dependence completely reverse their symptoms without a single pill. But here's where the story takes a turn. And it's a turn that I don't talk about in my initial consultations because I don't want to discourage anyone from trying. The truth is, for about 40% of the men who come to my office, this massage does absolutely nothing. They follow every step. They do it religiously every morning. They apply the right pressure, maintain the rhythm, breathe correctly, and yet nothing happens. No tingling, no warmth, no spontaneous response, just silence. At first, I thought it was a technique issue. Maybe they weren't pressing hard enough. Maybe they were rushing through the phases. But after reviewing case after case, I realized the problem wasn't the massage. The problem was the tissue itself. When I ran vascular imaging on these non-responders, I found something alarming. Their microvessels were calcified. The smooth muscle cells lining the arterial walls had lost their elasticity. The nitric oxide receptors, which are essential for triggering vasodilation, were either damaged or completely unresponsive. In other words, the pipes were closed. No amount of external pressure or massage could force blood into tissue that was chemically locked down. This was a devastating discovery for me. I had built my reputation on non-invasive solutions, on teaching men how to reclaim their bodies without drugs. But now I was facing a subset of patients for whom my best tool simply didn't work. I couldn't in good conscience prescribe Viagra or Cialis to these men because many of them had underlying cardiovascular issues that made those drugs dangerous. The headaches, the blood pressure spikes, the risk of sudden cardiac events, it was too much. And the so-called natural supplements available at pharmacies, most of them were junk. Low-grade herbal blends with inconsistent dosing and zero clinical backing. I tested dozens of them in my practice and saw no meaningful results. Then I came across a pilot study out of a clinical research group that was investigating a very specific combination of compounds. Not just any herbal mix, but a formula built around high-purity Tribulus terrestris extract, standardized to 40% saponins, chelated zinc in a bioavailable form, and adaptogenic support from Panax ginseng and maca root. The study was small, only about 60 participants, but the results were striking. Men who had failed to respond to standard treatments, including PDE5 inhibitors, showed measurable improvements in both arterial flow and erectile function after 8 weeks on this formula. The mechanism wasn't mysterious. Tribulus acted as a natural nitric oxide booster, signaling the vascular smooth muscle to relax. The chelated zinc supported testosterone synthesis and protected against oxidative stress that degrades nitric oxide before it can do its job. The ginseng and maca worked on the hormonal side, restoring sensitivity in the hypothalamic pituitary gonadal axis. I was skeptical. I'd seen too many overhyped supplements to take anything at face value, but I decided to run my own informal trial. I took 10 of my non-responder patients, men for whom the PTM had produced 0 results, and I had them start taking this formula daily while continuing the morning massage. I didn't tell them what to expect. I just asked them to stick with both interventions for 6 weeks and report back. By week 4, 7 of the 10 men reported noticeable changes. Morning firmness was returning. Spontaneous responses during the day were becoming more frequent. And critically, the PTM was now producing the warmth and tingling that had been absent before. The formula hadn't replaced the massage. It had unlocked it. It had restored the tissue's ability to respond. This was the breakthrough I'd been searching for. The massage was the ignition, but the formula was the fuel. One couldn't work without the other in cases where the vascular tissue had degraded beyond a certain threshold. I started recommending this specific formula to all of my non-responder patients, and the success rate climbed dramatically. But here's where things get complicated. And it's something I feel obligated to warn people about, because this formula is so effective, And because word has spread through online health communities, there are now dozens of counterfeit products flooding the market. Fake websites, knockoff bottles filled with cheap fillers. Men are buying what they think is the real thing, and they're getting scammed. Worse, some of these counterfeit products contain undisclosed compounds that can actually cause harm. I don't sell supplements. I'm not a distributor. But I've had too many patients come back to me confused and disappointed after buying what they thought was the right product, only to discover it was fake. So I did the research. I tracked down the original manufacturer, the one that produces the lab-verified formula used in the clinical studies. The company is called Vigor Long, and they sell directly to consumers through a single verified channel. No third-party sellers, no Amazon listings. Just one official source. I keep that link available for my patients because I don't want them wasting money or risking their health on counterfeits. If you've been doing everything right, if you've tried the exercises and the lifestyle changes and you're still hitting a wall, the issue isn't your effort. The issue is a biological lockout. Your vascular tissue needs chemical support to respond again. I've documented the exact mechanism behind this shutdown in a clinical report I've made available. It explains why some men respond to physical interventions and why others don't. It breaks down the role of nitric oxide, the impact of zinc deficiency, and the way chronic stress rewires the hormonal axis. You need to see this before you spend another morning on techniques that might not be enough on their own. The link to that report and the verified source for the formula I use in my practice are in the description below. This is the safe way to access the real thing, not a counterfeit. For men who are ready to take this seriously, the protocol is straightforward. You start the PTM every morning as soon as you wake up. 3 minutes. No shortcuts. You also begin the Vigor Long formula, 2 capsules daily with food. You give it 6 weeks. Not 6 days. Not 2 weeks. 6 full weeks for the vascular tissue to regenerate and for the hormonal pathways to recalibrate. During that time, you track your responses. Are you waking up with firmness? Are spontaneous responses becoming more frequent during the day? Is the PTM producing the warmth and tingling it should? These are the markers. These are the signs that your body is coming back online. I've seen men in their 70s reverse symptoms they thought were permanent. I've seen younger men in their 40s who were facing a lifetime of pharmaceutical dependence completely turn things around. But I'm also clear about one thing. This isn't a magic bullet. This is a protocol. It requires commitment. It requires consistency. And it requires the right tools. The massage alone won't save you if your tissue is locked down. The supplement alone won't save you if you're not doing the physical work to stimulate circulation. You need both. That's the formula. That's the system. If you found this information valuable, if you're ready to stop wasting time on half measures and start addressing the real biological factors behind your symptoms, make sure you subscribe to this channel. This is where I break down the science. This is where I share the clinical strategies that actually work. And remember, the full clinical report and the verified link to the only trusted source for the formula I use in my practice are waiting for you in the description. Don't let another morning go by feeling disconnected from your own body. The tools are here. The knowledge is here. Now it's your move.